What you will be asked on the NRCME exam. First, we would like to point out that if you have watched the video modules in order, then this is the last video. Your next step is to take the sample NRCME exam. As explained in the course instructions in the introductory video, the CME certificate of completion will appear immediately in your CME tracker after you complete the entire course, not just the video modules. The 2-hour NRCME exam consists of 120 questions, 20 of which are pilot questions which are not scored. You will not know which test questions are the pilot questions. A score of greater than 70% is required to pass. The nature of the NRCME examination has changed. Whereas the focus of the exam used to be exclusively on FMCSA regulation and guidance, now a significant portion of the exam asks questions testing general medical knowledge. We have changed the course to accommodate this new focus and want to emphasize how important it is for you to know the answer to every single question in the sample question bank and on the sample NRCME exam. In addition, make certain that you are familiar with every item included in this lecture. We list terms and diagnoses that are not part of the NRCME curriculum but do appear on the NRCME certification exam. If you are not familiar with any of these items, please be sure to acquaint yourself with them before scheduling the exam. There are two fundamental concepts that govern many of the questions on the NRCME exam. These two concepts trip up many providers. You will likely encounter several questions regarding a specific diagnosis or medical condition asking you how to proceed. The condition may not have been covered in this course, or you may not even be familiar with the condition. The point of these questions is to emphasize that as a DOT examiner, you are not the primary care provider. Your role is to refer the patient back to his or her PCP for further evaluation. Some test takers get flustered because they focus on the diagnosis or condition being discussed and fail to realize that you do not need to know which tests you should order because the correct answer is to refer the driver back to the PCP. Approach these questions solely as a DOT examiner, not as a primary care provider or specialist. Similarly, if you are confronted with an abnormal physical finding that compromises safe driving, you cannot certify the driver and you must refer the driver to a PCP for evaluation. There has been a change in what is considered the best or most correct answer in the more recent test versions. Whenever you see a question that lists additional testing as answers, as well as another answer that is a referral to a specialist, choose to order the correct additional test. Only choose to refer the driver to a specialist if it is the only possible correct answer. So, the first overarching concept is that you must always answer the question from the perspective of a DOT examiner, not as a primary care provider. The second concept is to recognize that many questions are worded such that they ask, "What does the examiner do next?" All of the answers might seem reasonable, but the key here is the word next. Unfortunately, many test takers skip through the questions very quickly and do not see the word next. This usually means that a history is taken before the exam, which is performed before testing, and so forth. So, for example, if you are asked about a driver who failed the hearing test that was performed by an assistant, and are asked, "What does the examiner do next?" choices may include ask the driver about a history of hearing problems, perform an otoscopic examination, or refer to an audiologist. All of these may be reasonable, but the very next step is to ask about the driver's hearing history. Similarly, you will have several, if not many, questions where the answers include ordering various tests or making a certification decision, but one of the answers is to ask for more information or obtain the driver's medical records. Unless there is a clear-cut correct answer, lean towards selecting obtaining more information, as this is usually the correct answer. Expect many questions on the hearing and vision standards. You should know these criteria inside and out. Know the hearing qualification requirement for the audiometric test, as you will likely be asked about it. Remember that the driver must have an average hearing loss of less than or equal to 40 decibels in one ear, averaging the test results for 500, 1000, and 2000 Hertz. The exam question may include results for 4000 Hertz, which you must ignore and not include in the average. Furthermore, You must know that the test results are based on the American National Standards Institute, ANSI, standard. You may well be asked to interpret an audiogram graph, such as the one shown here, to determine which ear or ears meet the hearing requirement. This is straightforward as long as you know the hearing standards. There are several other items from the curriculum that often appear on the NRCME exam, which we will now review. The NRCME exam also typically asks questions regarding pulmonary function testing. Know the proper order for PFT testing. Indications for obtaining spirometry include a history of any specific lung disease and symptoms of shortness of breath, cough, chest tightness, or wheezing. No further testing is necessary if the lung function is normal and no other abnormality is suspected. Abnormal lung function should be further evaluated. Screening pulse oximetry, or arterial blood gas, is indicated when a pulmonary condition causes airway obstruction and PFT results are FEV1 less than 65% of the predicted value, FEV1 FVC ratio less than 65%, or a restrictive impairment is present and the FVC is less than 60%. If pulse oximetry is less than 92%, FMCSA guidance states that the driver must have an arterial blood gas. You must know that the minimum required partial pressure of arterial oxygen is 65 millimeters of mercury at altitudes below 5,000 feet, 60 at altitudes above 5,000 feet. Be very familiar with proper completion of the medical examination report form, Form MCSA 5875, especially page 4. It would probably be a good idea to fill out a page 4 on a hypothetical driver ahead of the exam. Know what to do when you suspect the driver is under the influence of drugs or alcohol. Call the FMCSA or the employer when you have reasonable suspicion. You should also know the role of the substance abuse professional, whose job it is to evaluate drivers who have violated the drug and alcohol regulations and provide a plan of care for reinstatement. You can expect questions regarding guidance for cardiovascular issues. Know the passing standard of an exercise tolerance test. To refresh, the driver should be able to exercise to a workload capacity greater than 6 metabolic equivalents through Bruce Protocol Stage 2 or equivalent, attain a heart rate greater than or equal to 85% of predicted maximum, unless the driver is on beta blockers, have a rise in systolic blood pressure greater than or equal to 20 millimeters of mercury without angina, have no significant ST segment depression.
The NRCME exam has moved away from asking many questions about recommended waiting periods, but a few of the same questions do keep coming up. Be familiar with the recommended cardiology waiting periods and the waiting period following a TIA. 2 months following a myocardial infarction, 3 months following a CABG, 1 week following PCI, 1 year following a TIA. You can expect a few questions related to the skill performance evaluation. Recognize that the SPE applies to drivers with a fixed deficit of an extremity, such as an amputee with a prosthesis, and that loss of a finger does not necessarily require an SPE certificate. The NRCME exam often asks about proper exam attire for the driver during the DOT exam. The answer is underwear and a gown. There are certain concepts that keep coming up on the various versions of the NRCME exam, even though the questions themselves vary. Remember that examination of the tympanic membrane and the pupils are part of the required exam, as is a hernia check. If a driver's blood pressure is initially found to be high, the examiner is to recheck the blood pressure before making a certification decision. For a driver who meets the vision standard by use of contact lenses, the examiner is to advise that the driver is to carry a spare set of eyeglasses. Similarly, for a driver who meets the hearing standard through use of hearing aids, the examiner must advise the driver to carry a spare power source for the hearing aid. For an insulin-dependent diabetic, a supply of available glucose in case of a hypoglycemic episode should be recommended. Know what to do if a driver exhibits glucosuria. The correct next step is to refer the driver to a primary care provider for evaluation. You will likely get several questions that describe the circumstances of a driver, and then you will be asked which of the 4 possible answers is of most concern to you as an examiner. In such circumstances, dizziness is often the correct answer, since the presence of dizziness prevents safe operation of a commercial motor vehicle. Similarly, falling asleep at the wheel is another symptom that is of paramount concern. Some versions of the NRCME exam will ask about the indications for a federal DOT drug test. A federal DOT drug test is required pre-employment, post-accident, when there is reasonable suspicion by a trained company official, as part of a random drug or alcohol testing, as part of return to duty testing for a driver who has previously failed a DOT drug test. The NRCME exam often includes 2 or 3 questions that emphasize the prescription exception. You will recall that in order to certify a driver taking a controlled substance, the examiner must ensure that the medication is prescribed by a licensed practitioner who is familiar with the driver's medical history and has advised that the substance will not adversely affect the individual's ability to safely operate a commercial motor vehicle. Therefore, expect some questions that ask about the following types of situations. A driver who is using his wife's narcotic, he must be disqualified, obviously. Or a driver who mentions that he is taking a narcotic intermittently for chronic pain. You can only certify this driver if the prescribing provider is familiar with the driver's medical history and attests that the medication will not adversely affect safe driving of a commercial motor vehicle. You will likely be confronted with several questions regarding hand conditions. Your goal here is to recognize that your main concern is to establish if the driver can safely operate a commercial motor vehicle. You will be given a short history and then asked what your next step should be. Typically, such questions describe a driver with surgery for a condition such as carpal tunnel syndrome or a driver who has sustained an amputation of a finger. Your first step is to assess grip strength in such drivers. This is your first step in assessing if the driver can be certified. Select this option before considering imaging and referrals. Expect several questions regarding alcohol use disorder and how to certify a driver who wants to return to work following a diagnosis of AUD. Remember that the examiner must ensure that the driver has no current signs of active alcohol use disorder and that if the driver has completed a substance abuse rehabilitation program, clearance from the SAP is needed before certification. A letter from the employer that the driver has returned to work is not sufficient. You must make sure that the driver has been cleared by the SAP. You may also be asked to recognize a driver with clinical symptoms of alcohol use disorder who should not be certified, such as a driver being prescribed Antabuse who presents with mild tachycardia and a tremor. There are sometimes questions asking about the use of the CAGE questionnaire to diagnose alcoholism, so be familiar with the questions on the CAGE questionnaire. There are often several questions about a driver presenting for certification following a recent surgery. The goal of the FMCSA here is straightforward. It wants to know if the driver can safely perform all tasks of a commercial motor vehicle driver. You do not need to be an expert in the condition for which the driver had surgery. You just need to know if the driver can safely drive a CMV. The key here is to recognize that DOT exam certification comes with no restrictions. So finding out about any restrictions from the surgeon is important. And finally, before we move on to discuss general medical knowledge questions that appear on the NRCME exam, we want to point out one item that has recently started to appear on the certification exam. The FMCSA has stated that for any surgery within the past 5 years, the certifying medical examiner needs specific documentation to assess the potential risks of certifying the driver. You may have one question listing 4 surgeries and asking which requires additional documentation. The surgery that occurred within the last 5 years would be the correct answer. Beyond the topics covered by the NRCME exam curriculum that focus on FMCSA regulation and recommendations, there is a new emphasis by the NRCME exam to test the provider's breadth of medical knowledge. Certain subjects appear frequently. Please pay careful attention to the following slides that review the general medical knowledge items that often appear on the NRCME exam. Providers who struggle with the NRCME exam do so because of difficulty with the general medical knowledge questions. You may have questions about various ocular diagnoses. Know the basic symptoms associated with cataracts, glaucoma, macular degeneration, diabetic retinopathy, and amblyopia, especially amblyopia, as there always seem to be two questions related to this diagnosis. The sample question bank included in this course contains many questions on these diagnoses of the type you can expect to see on the exam. There tend to be many questions regarding musculoskeletal back and neck pain and associated radiculopathy. Be familiar with the findings of a herniated disc at L3-L4, L4-L5, and L5-S1, focusing on the reflexes at each level. You need to be familiar with Sperling sign and Laseg sign. There are often questions asking about the normal range of motion of the shoulder and cervical rotation. Cervical rotation of 80 to 90 degrees is normal, and down to 45 degrees is generally considered adequate for commercial motor vehicle drivers. 30 degrees, for example, would not be acceptable for certification. There may be a question or two asking about the signs of gallstones and kidney stones. There is often a question about the risk factors for DVT and a question that tests if the provider recognizes that varicosities may be a sign of something more serious, such as an impending DVT. The provider should be familiar with normal urinalysis values and what hemoglobin A1C levels indicate diabetes. The Nrmc exam also frequently asks questions about the use of the Romberg test on the neurological exam and the significance of the finding of xanthelasma, that is a marker for hypercholesterolemia. The Nrmc exam always seems to ask several questions about liver disease. You only need to understand that cirrhosis carries with it the potential for many complications that can impair safe driving. So if you are asked to select a condition that has potential to impair safe driving, select cirrhosis, and if you detect hepatomegaly on exam, do not certify the driver until you have a diagnosis and more information. The FMCSA also likes to make sure that the provider understands which drugs require serum level testing to ensure that the driver poses no risk. Such drugs that come up on the exam include theophylline, Tegretol, and lithium. And finally, we will finish up with a list of medical terms that frequently either appear in questions or as one of the multiple choice answers. Please be familiar with each of these terms: acrocorridon, arcocinilis, xanthosis, and isochoria. We want to once again emphasize that it is critical to review all of the questions in the sample question bank and sample NRCME exam. You should not schedule the NRCME certification exam until you can answer all of these questions correctly. And remember, when you take the NRCME exam, answer the questions as a DOT examiner, not as a primary care provider. Your job is to certify the driver if the driver does not pose any risk as a CMV driver, disqualify if the driver does pose a risk, or refer for more information if the answer is not clear. Your job is not to make a diagnosis or suggest a workup. That is the job of the PCP. This concludes this module. Good luck on the exam.